So our first session today is with Dr. Eric Williams, and he is a very recently retired vascular surgeon, but he's also the chair of the Future of Medicine Committee. So he is the brains behind this Future of Medicine program operation. So before he asked SSVMS to actually take this program over, on his own time over the last, what do you say, 8 years or so,
About
Dr.
8
Williams?
years, 9 years.
Yeah. You did a version of this program with Kaiser Permanente for free for students because you are just so passionate about students like these young faces that we have and the future of the medical profession. So remember, guys, ask your questions to Dr. Williams throughout the presentation. Please actively participate. We want to hear from you. We want to talk to you. We want to know what you think. So Dr. Williams, please take it away.
Okay, awesome. It's great having you all here. Sam, if you could just start the video, that'd be awesome, the first one. So why did we choose this title, The Future of Medicine? And I hope each of you understand, and as Lindsay pointed out, I've retired. I need people like you with the innovation and the insight to take the place of people such as myself. Do not undervalue what you have to contribute, because your perspective, your vision, your hope for the future is what will make us succeed. Your involvement here will help take care of your community, whether it's your brother, your mother, your father, your sister, uncle, and your neighbors. Many of you will find that what you're seeing here and what you're experiencing, you probably take back to your churches, your community. You will now see things very, very differently because of the knowledge that you've gained and the insight. We want to push past that knowledge and insight, though, into giving you some concrete information that you'll be able to use in taking your next steps. If that means going to college, great. If that means going to a technical school, that's what we want you to be able to do. And we want to be able to help you and be next to you as you go through that journey. One of the other things I want you to do as you go through this is find a mentor. Identify someone who you can resonate with and stay in touch with them. That's why we're here. That's why we're doing this. And we truly want each of you to succeed. Either way, this experience will tell you if this is for you or it's not. You may be totally turned off by it, but at the end of the day, you will know that this is one thing I'm not going to put on my list, and I'm going to look at another career. So be prepared, because there would be some tough things to look at here. And if you find that it's not for you, don't give up just yet, because it's the first time you're being exposed to it. And there will be a tolerance that will be set up. You will also look at it differently once you have that fund of knowledge. So here goes, next slide. So what's my story? From my accent, you could probably tell that I'm not a Native American. I'm from Trinidad, West Indies. And I came here when I was 17, went to undergraduate school. My father was a mechanic. He passed away at 99. He was a mechanic, a mason, a cabinet maker. He did what he had to do to take care of his family. My mother stayed at home. I had one brother and 10 sisters, big family. And my responsibility was to help my father in the garden and take care of the cows, goats, pigs, etc. I was not an inherently smart kid, okay? But I asked questions. And if I didn't have the answers, I looked for the answer. Anyone here remember reading about encyclopedias? the old internet? Well, that's where I got so much of my knowledge, whether it meant looking at art, science, etc. It was fun. but I learned to adapt and problem solve, and that I gained from my father. Next. So I mentioned to you that we needed you and your vision of things. This, many of you would say, this looks like an elephant sitting on a bluff overlooking the beach, and it does. But I put this here to highlight the point that many of us who are in medicine right now would see this, and depending on where we are in relation to it, we would see an old tree stump. But you, with your fund of knowledge, your background, would see an elephant. And once you see the elephant and you show it to other people, it suddenly becomes obvious, or it may not. But you have particular attributes that can push our fund of knowledge forward. And that's what we want to harness. That's what we want everyone to benefit from. Next slide. So what's a vascular surgeon? That's what I did before I retired. My history, though, like many of the other people who came through here, was a little bit different. Getting into medical school was tough. I did my undergraduate degree in chemical engineering. Didn't get into medical school right away, so I went on and did a master's in environmental and civil engineering, then got into medical school. All of that to say, that gave me a perspective that I was able to use, and it's probably natural that having gone through chemical engineering and dealing with flow and structures, that I would look at vascular surgery. So vascular surgery involves aortic aneurysms, and what that means is that this big vessel in your body that goes from your heart all the way down to your navel gets too big and it can rupture and you will bleed to death. Sometimes clots can develop in it and it can go to and block things off, and then all of a sudden you've got a different problems. Some of you have known people who've had strokes, and yeah, I could ask at this point, what does a stroke look like? If any of you have seen someone who's had a stroke or have had a family member who've had a stroke. Anyone? Feel free to put your hands up. So yeah, so it's a tough condition, and not everyone recovers from it. It can cause significant disability. If the stroke affects one side of the brain, it's the contralateral, the other side of the body that's affected. And there are different types of strokes. I put the word mesenteric vascular disease there. What that simply means is that the blood supply to your gut, you know, when you run, you've got blood supplying your legs, you've got blood supplying your heart, you've got blood supplying your brain. The blood supplying the gut is called the mesenteric vessels, and that has its own issues. Peripheral meaning in the legs and arms and so on. Again, the word renal here refers to the kidneys, and that too has its particular issues. And some of you may know people who've gone on to have kidney failure and dialysis. That too is in part because of the effect of blood flow to the kidneys. Some of it is intrinsic problems to the kidney, as you might get with diabetes. Vascular infections and other complications from bypass, that is a huge issue. That's why we are so bent on sterility. If you're going to put a graft in someone, taking it out if it gets infected is highly traumatic. Less critical and less life-threatening would be varicose veins. And some of you have seen folks, particularly now as they're out there running and walking with shorts on with big, huge veins on their legs. I'm sure you've seen that. And if you haven't, next time you go walking, look for it. You will see it. Some people may get ulcerations on the inside of their ankle because of it. Anyone here heard the expression of elephantiasis of the legs, where the person's leg looks like a tree trunk? That's in part because of something called lymphedema. The vascular malformations tend to occur in kids. There may be hemangiomas. Some of you may have what we call birthmarks. That's a type of vascular malformation. In many cases, it is not life-threatening. Next slide. So if you can see this image here, this is an image of someone's leg, the outside of someone's leg, and you can see what looks like a grayish, bluish discoloration of the leg. This person has what we call a hematoma. That means a collection of blood under the skin where they bumped it. In many cases, the person is on a blood thinner. And if we don't address this now, it becomes something even more remarkable down the line, because the hematoma is putting a lot of pressure from the inside onto the skin, and blood is not able to flow to the skin very well. And if it doesn't, the skin dies. And you see the extent of this hematoma. And we can avoid that by doing something fairly simple if we know about it in time. Let's go to the next slide. So many of you, and we talked about staying in touch with your mentors. I had some influences growing up. The reason I got involved with vascular surgery is because I was about 10 years old, sitting outside a shop, and this person had their radio on in the store very loudly. And I heard the announcement of Dr. Christian Bernard performing the very first heart transplant. I still get shivers every time I think about it. And it was amazing to me that you could take the heart out of one person and put it into another one and get it started again. And more than that, where you put them together, they don't bleed to death. I mean, that is fantastic. And you met some of the folks involved with the lab and all of the teams that are involved in making sure patients bleed or don't bleed, testing to make sure the blood types are compatible. You can understand how it takes a lot more than just a surgeon to treat a patient who needs a heart transplant. And then you've got the heart in there. How do you prevent them from rejecting it and having that heart die? We've come a long way from Christian Bernard, but that's the thing that got my attention. And from then on, it was a straight shot to, yeah, I'm going to do medicine. Zija Hasnain, he was one of my instructors in high school, and a very interesting occasion occurred when he asked me to have my father come to school and have a conference with him. How many of you have had your teacher say to you, I want you to bring your parents in, I want to have a conference with them? Is that often a good thing? Not usually. But he apparently saw some potential in me that said, you're taking too much time to take care of things on the farm. You need to study, and you can do this. Once he spoke to my dad, I had a little bit more time to study. And that changed my trajectory quite significantly. But like with everything else, you have your naysayers. And my naysayer was a woman by the name of Mrs. Fevek. She has long passed, but I've never forgotten her words to me that, Eric, you should not go to medical school. You just can't hack it. Well, true to form, and I think my son adopted the same principle, and his response and mine was, is that a challenge? So I did it. Dr. LaSalle Lafall, he was an influence of mine. He was the head of the surgery department where I completed my residency at Howard. And Dr. Ralph Dilley is the one in San Diego at Scripps Clinic who trained me in vascular surgery. Very gentle, very insightful, elderly gentleman. And it was great working with him because I love seeing him get into trouble. And he asked me one day why. And I said, well, I'm going to get into trouble one day too. And I'd like to see how you solve it, because it's going to give me some insight as to how I might do the same thing. And you will hear that alluded to during the presentation. Next slide. So I spoke about my mother and father. There's my father and there's my mother. Then he was probably about 90 years old and my mother was 80. They both were born on Christmas Day and about 10 years apart. My mother is still alive. She'll be 94 this year. Next slide. By the way, my father passed away when he was 99, so I have a ways to go. So what's my typical day looking like? We talked about life balance. Take care of yourself. Even though you're seeing a lot of sessions here about medicine, you've probably heard it time and time again from each one and each individual who presented. You got to take care of yourself. Take care of you, or you can't help anyone else. It's like flying in the plane. Put on your seatbelt first, get your oxygen first before you try to help anyone else. Get some breakfast in the morning. Whenever I got to work or at home, I checked my messages, responded to those, and went in and did rounds. Rounds probably started around 5:30, 6 o'clock. And that was fine for me because during medical school, I was a phlebotomist. And that's how I paid for medical school. So getting up early was no big deal. Following rounds, I either went to clinic or the operating room, went to meetings, and in the evening rounds again, you would like to know what happened during the day. I have not been with the patient all day. The nurses have, the techs have. So whenever I went to see the patient, I would go meet with the nurse and ask them, what happened during the day? What did I miss? What have you all done? What do I need to know? Should this patient be having some other procedure? Should I be looking at something else? Because they've been there with them. At about 7 o'clock at night, my day is done and I'm tired. But I've done something to make a difference in someone else's life. So I'm good tired. As John Lewis said, good trouble, I was good tired. Next slide. So we are not always successful. Sometimes we fail at what we were trying to do. This is an individual who was diabetic, had arterial blockage, so blood flow was not getting to their extremity, and the toes died. The podiatrist came in and attempted to remove the front of the foot, and as you can see, that dark area there is all eschar or scar tissue. It is not healing. Their next step then in recovery is to perform an amputation. And where do we do that? Below the knee or above the knee? It all depends on what the patient's blood supply looks like. That will determine the next step. If they are sick, if this looks infected and it doesn't, then we need to do it in different stages or emergently. Next slide. I got to bet that most of you know who this person is. And why do I have them here? This is Albert Einstein. He is the reason many of us have gotten where we are now. So you don't have to know who he is, but why are we talking about him here in vascular surgery? Believe it or not, he was in his 60s, he died from a ruptured aneurysm because we did not know how to treat it at the time. Those of you who spend time in the kitchen, and this goes as well for the guys as well as the gals, you guys can cook too. The cellophane paper that you have in your kitchen, we tried wrapping his aorta with that. Needless to say, it didn't work. Next slide. This is what an aneurysm looks like. You see the measurement there, 56 millimeters, and I'll try to orient you a little bit. The top of your image is the front of your belly. The back of the image and that big old white structure back there, that's your backbone. And the sides you can see. On the left side of your image, you see that whitish structure, that's your left kidney. Now in the middle where that measurement is taken, and it says 56.2 millimeters, that's the size of the aorta, that's big. It should be no more than 2 to 2.5 millimeters. At that size, the risk of rupture is high. We don't repair every aneurysm when we see them, but when we get to a point around 5.5 centimeters where the risk of rupture is greater than the risk associated with repairing this aneurysm, we fix it. And there are a couple of ways we can do it now. We can make small puncture wounds in the groin and put a graft, like an inner tube from the inside, so that blood no longer flows in the native vessel, but it flows through the graft. So we deploy it as something as thin as your pen that you write with, and then we open it up on the inside of the vessel. That area in it that looks white, that structure, that's the area where blood is flowing. The rest of it is just clot. There is no blood flowing through there. Next slide. How do you get to a point where you can function as a vascular surgeon? College, of course, 4 years. Medical school, again, 4 years. The first year of residency is called internship. And I know some of you look at Grey's Anatomy, so you're pretty doggone familiar with it. But those things you see in Grey's Anatomy is not what really happens. Not all of it, I would say. Residency used to be 2 to 5 years, followed by fellowship. That has changed because we are trying to get people to the point where they can function as a vascular surgeon sooner. And we are finding that there's such a division of labor that residency has now become non-essential for people who are going on to vascular surgery. But the vascular surgery training is still 2 to 3 years. So you would go through a period of internship, and then you would go through a fellowship in vascular surgery. Next slide. So I showed you the individual who had that little bruise on their leg. If nothing is done about it, this is what it looks like. Does that tissue look like it's alive? No. What that means is that while we could have saved that skin, that bruise earlier, we now have to remove all of this tissue because it's dead to allow it to heal. And in many cases, we'll have to put a skin graft on it. I'm sure many of you have fallen and gotten a pretty bad road rash where it looks pink and the skin is gone. But you heal because your skin cells recover from the base of the hair follicles. And from then it spreads one to the other. And it's amazing to me that the skin knows when it's touched another piece of skin because it doesn't keep growing forever. When skin touches skin, it stops growing. And that's the difference between normal skin and cancer. But that's another story altogether. Next slide. So, who is your Mrs. Fevick who's told you that you can't do something? Don't let that person be yourself. You have to drive your own train. There will be someone in your life who sees you and recognizes that you have that talent, you have that drive. Seek that person and then find someone who's willing to support you. Next slide. This is another slide of an aortic aneurysm. This is even bigger. And one of the ways you can use the structures there to orient you, look at the backbone. You see that oval shaped structure? That's the vertebral body. It is significantly larger than that. Next slide. So, a few questions for you all. Anyone can guess what the length of vessels might be in your body. And you can put that down in the chat and we're going to go through them. And if you're looking at most people, are they right or left-handed? Most people are right-handed. But the reason I put that in there, it's because the left carotid, the vessel to the brain, controls the left side of your brain. But if you have a stroke that's related to the left carotid, your symptoms will be on the right side of your body. And that's because your nerves cross as they go through the spinal cord. We talked about the diameter of the aorta, and I would be amiss if I didn't talk to you about the signs of stroke. And you see them here. They're very similar to someone who's had a heart attack or someone who can't walk. That person may develop an inability to move one side of the body. They may develop weakness or numbness on one side of their body. They may even tell you, I can't see or I can't speak. That gives you some sense of where the stroke is occurring. Having said that, if there's a member in your family or a friend or family member that has signs of strokes, get them to the hospital as fast as you can, because we can usually recover that brain function. We can dissolve the blood clot if you can get them there quickly enough. So, next question. How much blood is there in the body? It's about 5 liters. It's about 5 liters. And depending on how much you lose, that person can be in different types of shock before they pass out. And there's something we talked to about that. I mentioned earlier that I was intrigued by the heart transplant and why someone didn't bleed to death. Your body is in a constant flux of allowing blood to flow and stopping you from bleeding. And that's something that happens constantly and the body monitors it. If in some cases, if a patient has had a graft or they've had a heart valve, we sometimes have to give them additional medication to prevent them from clotting. Next slide.
Dr. Williams, you
Yes.
have a couple of questions here. Are these pictures, oh, that's just lovely. Are these pictures that you're showing us from cases of your actual patients?
Yes. And I will look at it.
Okay, and then one more question. Somebody is wanting to know what's the worst case or wound that you have had, that you've seen.
I will tell you don't know if it's the worst case. I'll tell you 2 interesting cases. One was of a woman who had an aneurysm in her belly, a blockage of her aorta in her chest, and blockages of the vessels to her gut, kidneys, and legs. We started operating around 7 o'clock in the morning. We were done around 7 o'clock at night and got her to the operating room, and she developed signs of lack of blood flow to her gut. It was a holiday. There was no one else other than the resident. And she had had a lot of surgery. And the question I had was, what can I do for her? Because I'm tired, but without anything being done, she wouldn't make it. So she and I had a conversation at the bedside. She still had the breathing tube in, but I promised her that if she was willing to fight and try her very best, I would go back in there with her, but it was going to be really, really hard. And this followed the conversation we had before surgery that says this is a big operation. We went back, we were done around midnight, and I was so proud of that woman. She fought like anything else once the breathing tube came out. And about 10 days after surgery, she left the hospital, and we had stayed in touch. Patients sometimes succumb on the table, and that's a very, very hard thing to go out and tell the family. But at each point, you have to let them know that you're doing your best. You're going to do everything you can. The team will be working with them to get them through it. Another gentleman arrested immediately after getting on the table, right after we had gotten into his abdomen. And we used the cardiac machine to defibrillate him. We pumped him in his chest, and he did not respond, and we did that for about 30 minutes. The machine said we should stop. The team said we should stop. We decided to move forward, and his heart started. He survived, and he decided, yes, I want you to operate on me again anyway and fix this problem, which we did. He subsequently got married, met both himself and his wife, still remember his name. But those are some interesting cases. So we have good and bad.
Okay, no more questions. No more, keep going.
One more question. So what this is here is an aneurysm in the forearm of someone right in front of your elbow. So we went in, removed it. We were able to join the two vessels together, and person did fine. The problem with aneurysms in the forearm, as you can see, is that they're not very big. They're not going to rupture, but they develop blood clots, and they can go down to the fingers and block vessels, and all of a sudden, you've got someone coming in with a white, painful hand, which they can't move, and they can lose that extremity. So we remove those. Next slide. Anyone ever heard the name homunculus? This is the expression of your body on the brain. It's an upside down man. So the head is on the lower part, so about the area of your ear, and the foot and buttock area up on the top of your head. You will hear that again. And this is how the brain has your body reflected in itself. Next slide. So I put this in here. This is part of a poem I wrote, and this is something I alluded to as we went through. And I would ask each of you, no matter what you decide to do, whether it's medicine or something else, and it's a piece of a poem that I took an excerpt of, and this is where I am now. Sharpen someone else's knife. Pack someone else's bag with skills. Make someone else's connections. And as you bend forward, help someone step upon your back and rise. And that is why you've got this many people, these many techs and physicians and others speaking to you now, because we know that you are coming next. Next slide. This is a picture of someone who has diabetes, and this little wound on their foot is the beginning of a threatened limb. It needs to be addressed immediately. Whether it's antibiotics or debridement, meaning to remove dead tissue. But if they've got poor blood flow, antibiotics alone will not do it. We've got to improve their blood flow, and that may involve performing a bypass graft or removing blockages in the vessels. So for those of you who have people who are diabetics in your family, people who've had heart attacks at young ages or strokes, encourage them to look at their feet. And you can do that by offering to do it for them. Look at the top of the foot, look at the bottom of the foot. It can tell you a lot. If the nail is thick, that's a problem. Next slide. So you are the future of our medicine. That's why we're speaking to you today. But we are really far behind the 8 ball. And COVID-19 has cost us a lot. We've lost a lot of people due to COVID. We've got people retiring due to the COVID. And the question you have to ask yourself is, what do you take from this? How does this affect you? Does this motivate you to move forward and to help, to make a difference in your community? Next slide. You can see 2 structures down here. The aneurysm has extended down into the lower belly, and it's now huge. Next slide. These are some reading recommendations. We will send this to you. I would encourage you to read them all. Premonition talks about where we have been most recently with the pandemic and others that will likely come. David and Goliath speaks to what looks like a disadvantage. And many of you may feel that there are issues in your life or in your community that puts you at a disadvantage. That can be turned into an advantage. You can remember David was a scrawny little boy who was a shepherd boy. All he had was a sling. Goliath was huge with lots of hardware to protect him. But David was able to turn his skills and his attributes into an advantage. Anatomy remained ridiculously simple. Get your hands on that. That's a must-have. I wanted to put that in there to remind you that not everything is about medicine. Emotional intelligence, get that now and read that as you go forward, regardless of what you decide to do in your life. When Breath Becomes Air is a very personalized story of a gentleman who was an excellent doctor, a neurosurgeon. His parents were from India. His mother was a teacher, and they moved down to Mexico, and not Mexico, to Arizona. And he read, he was a great person, and he subsequently developed a type of brain cancer. He died from it, but he started writing this book before he passed away. And it's really, really worth reading. Next slide. Next slide. So I've got a couple more minutes. So I'm going to go through this, and just to remind you that the future medicine can be broken up into the near future. Tomorrow, what do we do? Mid-future, I say, is 5 to 10 years, and the far fantastic futuristic, that's way away from here. So are we able to, Sam, are we able to pull up the clip on YouTube, the Star Trek?
No sound, Sam.
So what this is this is Leonard McCoy, for those who haven't seen Star Trek before. And they went through a lot of different adventures. And I put Star Trek in here because Star Trek has been the impetus for many of the things we take for granted today. And Star Trek was around as I was growing up. And I suspect it was around when many of the people who you see now and who've created things like the iPhone and other instruments was influenced by this show. Go for it. More sound?
What's the matter with you?
Kidney dialysis.
Dialysis? My God, what is this, the Dark Ages? Here, you swallow that. And if you have any problems, just call me. Here, I got it. Let's go. It's being held in the security corridor. One flight up. His condition is critical. Come on. Excuse me.
Dr. Williams, I can't really hear it. Can you?
Barely.
Emergency.
So
Yeah, I was there. I heard the whole thing.
what has happened is that they're taking a patient out of the hospital, and
We talked about was image therapy.
they are comparing where they are with medicine now and medicine in the past. And these are constant questions that McCoy, who is the doctor, being asked. Are you a doctor or not? So he's constantly evaluating where he is and what his purpose is in life. Let's pause it. Let's go on to the next slide. So I wish I could really speak to each of you to see what your story is and how this pandemic has affected you. If you can, in the chat, please just put a quick note of how the pandemic affected you and what you plan to do moving forward. It would really be helpful for us. Because truly there's a psychological aspect to this pandemic, whether it means separating you from your friends and the things that you did normally, it's really important. This pandemic and just tomorrow, what do we do in medicine is really important because there are social issues to medicine and the inequities we are seeing, and those were brought out by the pandemic. We've known about food deserts, that people are what they eat, and how expensive it is to eat well. It costs less to get junk food and a hamburger than it is to get a salad. Next slide. This is what that wound looks like after we took the dead black material off of it. And we're going to clean this up some more, and then we'll be able to skin graft it. Next slide. Again, the near future. We are seeing it again and again, the politics and medicine. We've heard that alluded to. And I'm not using politics in a negative sense, but I am saying, just like you saw yesterday, we do have to petition people. We have to drive the system to where it needs to go so that we could all benefit. In the near future, we have to ask who's going to pay for all of these things. How do we improve healthcare? How do we handle care for people in rural areas? We live in Sacramento, but trust me, there are areas in California where folks have to drive 50, 60 miles to get care, sometimes basic care. And if they need more advanced treatment, it's even harder. Next slide. But as I said, what has happened here is a catalyst. It's a silver lining. We've learned to take care of people at home. We have more remote medicine, and we've developed more technology to support it. We have to do further research on how we can improve people's care. And this is where your perspective comes in. Next slide. You see this little tiny incision right there? This is what that hematoma could have looked like if we addressed it sooner. This person does not need to have an operation. They do not need a skin graft, and they can go back to their business tomorrow, instead of the next 6 to 8 months of surgical treatment and care. This is where you guys and your smarts and your new insight comes in. You can change the trajectory of care. Next slide. So that iPhone, that flip phone we used to use, that's where tricorders were. Tricorder is something that can scan, record, and analyze. That's a Star Trek device. DNA analysis, you've heard about it. That's allowing us to treat people, to determine what's wrong with their DNA. And if any of you have heard about CRISPR, CRISPR is a technique that's now allowing us to remove segments of the DNA and treat that person's disease. We are doing it with sickle cell disease, something that shortens life and is really, really a tough things to have to deal with. And we are now using it for cancer and other treatment. It is huge, but CRISPR is just one technology. The rest of that technology is going to come from each of you. We are now looking at Mars and space exploration. How does going into space and the loss of gravity affect us, affect our muscles, affect our bones, and how do we cope with it? That's going to be for you all to handle. Next slide. This is what the wound looks like once we've cleaned it up and before we skin graft it. Next slide. We've got time to go to CPR. Let's do that.
Sam, do you want me to play it instead? We're good.
All right.
So, assessing the situation, are they breathing?
No, Rose, they are not breathing, and they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
All right, well, let's get back to it, because you're losing them. Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it.
Right.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, yes, I do. I love that song. First I was afraid, I was petrified.
No, it's Staying Alive,
Okay, yes,
Staying
yes, yes.
Alive.
You were in the parking lot earlier. That's how I know you.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man.
Okay, Sam.
Words it loud, women warm, been kicked around since I was born. Well, it's all right, it's okay.
Sam,
Sam, you can turn it off now.
it's going off the rails. Okay, guys. Next slide. So the future is you. And if you feel you can handle it, just jump in. The waters might be rough, avoid the rocks, but we'd love to have you in the field of medicine. And stay connected with us. Look out for the other presentations and take what you can. Take it home, talk to your parents, talk to your family, talk to your friends, talk to us. And don't lose track of us. We'll be here.
So there's a couple more questions for you, Dr. Williams,
Okay.
and lots of responses to your question about the pandemic. So I encourage you to read through the chat.
Okay.
But one of the questions that I don't believe I asked you, what are the risks and possible complications of just becoming a surgeon? What risks do you face?
You develop a high expenditure rate, and you may have a cost that's fairly high. You may end up finishing your residency with about $150,000 to $200,000 bill. But having said that, there are ways to defer that, whether it's by national service or going to an area where there's need. But the salaries are such that you can repay those loans. And many of us who go into medicine don't do it because of the money. But still, it's a great job, and we get a tremendous amount of satisfaction out of it. You do have to be careful, though, that you don't burn yourself out. You've got to be balanced, and we mention that time and time again. You also defer the development of your family, getting married, having kids, so you do have to learn to be patient. I'm sorry to hear about the stroke that your mom had. That's tough to have to live through that.
Does anybody else have any questions for Dr. Williams? Of course, you can raise your virtual hand. We'd love to hear your voice.
And I'm reading through the questions as well. Yeah, and the pandemic has taught you not to take your friends and your family and your loved ones for granted. It certainly has taught most of us that. Guys, if you have other questions, please feel free to forward them to us or forward it to me. You'll get my email and I will respond to you, okay? I hope this was helpful. And remember, we are exposing you, and you don't necessarily have to make a decision for medicine. You're just being informed. So that there's no pressure, there's no stress here. And if you need more information, ask for it. I see there was a question with a hand up there. Can you turn on your mic and ask? Okay. Lindsay?
All right, I don't see any other questions. So guys, please help me thank Dr. Williams for taking the time to talk to you, put together such a great presentation and a a real look into what it's like being a physician and a vascular surgeon. So guys, we actually did the timing right this time. So you have about 8 minutes before the next session. So please don't log off, but you can turn your cameras off and stay on mute. Go grab a snack, run to the restroom, whatever you want to do. But come back here at 1 o'clock, but please, again, don't log off so we can keep the connection. And we will be hearing about careers and community benefits and access to healthcare jobs. So it should be a really great presentation. So I'll see you back here in about 8 minutes or so. Thank you, Dr. Williams.
You're welcome. Lindsay?
Yes.
I just added one more book there for them to look at.
Okay.
It's called House of God.
All right, guys, it's in the chat if you're interested. And Sam will send this along in the email that she sends a follow-up email every day.
Okay.
After to the students. All right, I too am going to run to the restroom before the next session, so I'll see you back here in a minute.
Sam, thank you. This was great.
Thank you.
I'm still here if anyone had questions.
Sorry, Dr. Williams, is that okay if I share something with you?
Yeah, go ahead.
So I'm the one that said my mom had a stroke.
Yes.
She had a stroke.
Before you, are you okay? Because I'm not sure who else is able to hear you.
It's okay. It's
okay.
all right.
Go ahead then.
Yeah. So my mom had a stroke like 6.5 years ago when my baby brother was born. And a lot of people say that it's because they, you know how, so my mom had a C-section when my baby brother was born. And a lot of people say that the reason, because she had a stroke after that, like 3 days after that, she started being dizzy. She couldn't walk, she couldn't talk. And she was in coma for like 15 to 20 days. She really had a lot of bad days and stuff, but she has gone better and she's still under control, like taking medications and stuff. But she hasn't, like, she's not paralyzed, she's not like anything, but she's good. But a lot of people say the reason why she had a stroke is because they probably injected that, you know, that shot thing when they do in the back. When they have the C-section in their back, they have that shot. They said that they probably did that in the wrong way, like, you know, I don't know, but
yeah. I can see how sometimes we are looking at this and there's a concern that, you know, what did we do wrong? But one of the things I'll tell you as a physician, we constantly have to look at what we did and the outcomes and really analyze it, because we don't know what's going to show up in the next patient. And we have something called grand rounds, where we discuss these cases with a group, a larger group, and each person looking at it and trying to figure out, okay, what happened here? What do we learn from this? How could we make this good outcome better or repeat it? How can we avoid this bad outcome? And it alludes to that portion of the poem that I took out, you know, how can I help you avoid my mistakes? How can I help you move forward? How can I tell you the good things about what I did so you can do it as well? The thing about an epidural, which is what you're talking about, is that the nerves that it's going into and affecting are nerves that are affecting the lower abdomen and the lower legs. So it won't affect the parts of the brain, just like that homunculus showed you, that will affect speech. You understand?
yeah.
Yeah. So what your mom had is something that affected her brain as opposed to her legs by itself. So it's unlikely that it came from that thing in her back. But there are, God, it's amazing that women survive childbirth and pregnancy. There are so many things that could go wrong.
Yeah.
And in most cases, they don't. Have you ever heard something called preeclampsia?
No.
Did anyone ever say that your mother had really high blood pressure around the?
No, she never had any high blood
Yeah,
pressure.
because sometimes that will do it too. Some people have different types of strokes due to it. So I can't say exactly what happened to your mother, but it doesn't
But
sound like
because
it.
so like 8 years ago, I also lost my uncle, which is my mom's brother. And she was really sad, like, like as normal as it is, like when you lose somebody that you really love. And she was like hitting herself, like hitting her head in the wall and stuff. And a lot of people say after she had a baby, when she had the epidural, that probably had like, that's why probably, because like she had her head, she hit her head on in the wall so many times, and like that didn't happen very long time ago, but it happened like 6 years ago when she had the epidural and something. But a lot of people say different stuff. I really don't know what's going on, but
Yeah.
now she's okay. But the only thing that's wrong with her is sometimes her left hand, it's like she can't control it sometimes. Like it just, she can't even have control of her left hand most of sometimes, not a lot of times.
Yeah. I tell you though, one of the things that's doing clearly is that it's making you look at medicine with lots of questions, either
Yeah.
to answer them personally, but to gain more knowledge. So keep that drive. One day you may find the answer, but in the process, you will pick up a lot, and you may find it's something that you're drawn to. There are a lot of reasons why some of us get into different careers. But make sure that when you do it, you are happy in it and you're looking for the questions. And at the end of the day,